Advocates of long COVID research are pleading with Congress to put more money, time, and care into understanding and treating long COVID.
Minnesota Senator Tina Smith is on that committee that held a packed hearing this week. Our Renee Cooper has been following this request for research. Renee, you spoke to a patient who's from Edina who actually made that trek all the way out to D.C. for the hearing.
He did, Kirsten. I've talked to several patients. They tell me change has to come at the federal level to help the most people. Ranking members of the Senate committee say as many as 16 million Americans currently have long COVID, and even more have had it at some point after a COVID diagnosis. And the symptoms can be severe, lasting for years.
It's the first hearing in Congress on long COVID since the beginning of the pandemic.
Long COVID patient Chris Wexler of Edina.
I've lost the ability to work. I've lost the ability to be out of bed more than 4 or 5 hours a day.
Was in the packed Capitol Hill room as patients like him shared stories of years without answers, including from an athlete.
I was a healthy runner for nearly 2 decades.
And the mother of a previously healthy 16-year-old.
I'm watching my child suffer. I'm watching her sit down in the middle of a grocery store and just say, I can't go anymore. And meanwhile, I'm waiting to find the answers.
We are living through the largest mass disabling event in modern history.
Senator Bernie Sanders, heading the committee, said long COVID is keeping 4 million Americans out of work. All the while, patients reported their symptoms are either being brushed off or their doctors simply don't know how to help them. And some are driving hours for care.
I think often our problems in healthcare, like you could just sort of multiply them for people that are living in more rural communities.
Wexler, like a few Minnesotans we've previously reported on, has ME/CFS. The debilitating disease associated with profound exhaustion was known for decades before it also became linked with long COVID.
We knew this was coming, and we tried to alert everyone. We tried to sound the alarm.
Adrian Tillman, an advocate for ME/CFS research, says so far it's not been included in national long COVID studies.
And so they wasted a dramatic amount of that money.
Going forward, they're asking for an investment of $1 billion a year, and they ask that some of it goes to researchers already studying conditions like ME/CFS.
We felt heard. I don't know if we feel confident that the action is going to follow up.
I also wanted to note testimony today about the importance of reaching people who are disproportionately impacted by long COVID, particularly people of color and people who are low income. And important to note, Wexler said, thankfully he has the finances, but he spent $40,000 just last year on these medical bills.
Wow. Well, I know a lot of people are waiting for answers. All right, Renee, thank you.